It is Tuesday, September 7th. Welcome to the Morning Medical Update, coming to you from the Dolph Simons Family Broadcast Center. I'm Jill Chadwick in for Jessica Lovell. Today we're talking about the side of COVID that sadly too many people have experienced, including another 13 families since September 1st. 13 more patients have died of COVID here at the health system in the last 7 days, bringing the total number of our patients who have passed since the pandemic to 503. That's a milestone none of us wanted to reach here at the health system. These deaths are primarily among the unvaccinated. Joining us today to talk about the grief and the frustration that surrounds these deaths is palliative care specialist, is Dr. Karin Porter-Williamson. She is medical director of palliative care. And we also have Chief Medical Officer Dr. Stephen Stites with us for about 30 minutes.
Yes, ma'am.
Right? You got a heart out today.
I do. I have a clinic. I gotta go see some patients.
There you go. So we're going to dive into this crucial conversation in just a moment. But first, Dr. Dana Hawkinson joins us with our numbers here at the hospital. Have hospital patient admissions gone up as much as the deaths?
You know, again, every day we will have some admissions, some discharges. Our total number of active inpatient COVID patients is holding steady in that low 60s to high 50s group. Right now we're in 59 active infections with 17 ICU patients and 11 ventilators. Of those, 10 of those 59 active patients are fully vaccinated. We still have 47 in that additional recovery period, and Hayes has 13 total patients, 10 active, and 3 in that recovery period. But just as you said, total of 503 COVID deaths since the pandemic began, and 13 deaths in September. We did have 3 inpatient deaths on the 6th of September. And really since early September, we've had at least one a day, as you can see from our total deaths so far this month.
So, you know, really, that's a total of 106 patients. So that's a lot. And we are limited only by the numbers, I think, because of the transfer center. Because as we said before, we're not able to take as many patients out of the transfer center, and that's keeping our numbers a little lower than they would have been. If you look at the numbers nationally, there is beginning to be a decline in a number of new cases, and that's a good thing. But what we also have to be careful with, and I'm not trying to be doggy downer here, but we have to be careful with is last Labor Day, we were nowhere near these numbers, right? We were a lot lower. And then the impact of people getting together again and being in fall, schools opening, church, everything's starting to come back and open up again. We didn't really feel that, remember, until the end of October, November. So the ripple effect still occurs. So what we have to be thoughtful about is where will the ripple effect take us? And what we have to hope is that the rate of vaccination increases to the point that we have a lot more people safe. Increasingly, data is showing that even though you can transmit the Delta variant while vaccinated, it's a much lower risk than it is if you're unvaccinated. And what we also know is even if you're hospitalized with the Delta variant while vaccinated, even though you may be hospitalized, although 80 to 90% of patients are unvaccinated, the risk of death is remarkably lower. 98% of patients who die are unvaccinated. So it really, there's still, the key has always been that vaccination prevents serious hospitalization and death. If you go back to how we talked about it right from the start, that was the message. It is still the message. It still works. Along with, of course, we know that good old masking works well, too.
Right. We've got a lot of community questions already coming in. He's got 30 minutes, people. Let's start with...
I'll be out. You guys can keep talking.
We
will.
We will. Do we have reporters on the line? I think we do this morning.
Hey, good morning. Cody Holyoke with Channel 9.
Cody.
Hey, Dr. Stites, you mentioned this already with Labor Day and kind of comparing last year to this year. But we've got Rosh Hashanah right now. We've got a big Chiefs home game coming up later on this weekend on Sunday. What are your concerns headed into what could be a busy fall?
That it could be a really busy fall, Cody. Yeah. No, I think the concerns are what we've learned, right? I think in the absence of knowledge, which we really had a lot of last fall, you have to try and learn by the experiences you've had. And what we know is that last fall we thought, hey, we were doing okay. We had numbers that were lower. You know, the new case volume was down. I mean, this year, Labor Day, new case volume is up 300% compared to last last Labor Day across the United States. So the reality is that the things that happened then last fall is we stopped going to Chiefs games, right? There were no crowds, there were no the basketball game. All those things were so different. And now here we are, and we're already really open again. Our case volume's already much higher, and schools have opened back up again. And I think what we just have to recognize is that we probably are at greater risk this year than last year, with the saving grace being two things. Number one, that over 50% of the United States now has had 2 vaccinations, and that's good. But you ought to turn to South America, right? Because we think South America, the volumes, they must be exploding, things are terrible. But the reality is South America is down a lot. And what's different in South America than the United States? What's different? Well, first of all, there's not this huge mask fight. Mm-hmm. And second of all, vaccination rate's 70%. Mm-hmm. So, I think what we're seeing in the U.S., in those areas with really high vaccination rates, the communities are staying much safer than they are with low vaccination rates. So the answer to a safe fall is vaccination rate. And if we can get more people vaccinated, we'll be a lot better off, and the Chiefs games and the other things are going to be a lot safer. Now, I'm going to try and go this Sunday to the Chiefs game. I'm going to take them to the Chiefs game. I have my mask on. I'm going to do what I'm supposed to do, and I'm going to be good about it. Because there's also really good evidence. Look at Lollapalooza in Chicago. 385,000 people came together at Lollapalooza. You had to prove that you were vaccinated, and you were supposed to wear a mask. Now, I understand Lollapalooza, you had to wear a mask, but a lot of people didn't because, it's Lollapalooza, right? But they didn't have a huge outbreak from Lollapalooza. Why is that? Vaccination works, masking works, and being outside works. So I think what we have to conclude from that is we can go to the games safely if you're vaccinated. Got a mask on when you're in crowded public spaces, when you're outside, inside especially when you're outside. I'm sure there's going to be some people with their mask off at the Chiefs game. But I think that's really the key. I am concerned about the fall, though, Cody. I am concerned about the fall when we start going back inside if we don't have masks on as the weather gets colder. And because it took us 2 months to see the full effect of school reopening, I think we're probably going to have the same thing happen this year.
Are there more questions? All right, we're going to dive into our conversation then. Why don't we start, Dr. Porter-Williamson, with just telling us what palliative care medicine means here at the health system, just so people understand clearly, and how maybe it's changed since the pandemic.
Yeah. So thanks for having me on today to talk. I really appreciate it. This is such important information for everybody to know. Palliative care is a team-based approach to care where we typically provide an extra layer of support for patients and families and all of the doctors and nurses taking care of them to make sure that our medical care plan is fitting with what a patient and family are hoping to achieve with their medical care. Yeah.
So when you have people that are not vaccinated and there is a vaccine to help them from being so very, very sick, how do you handle that with families? What are you experiencing? And talk about it from the perspective of the staff as well.
Yeah. When we're in the ICU, we know the data suggests that the vast majority of people that we're taking care of there are not vaccinated. And when I'm at the bedside, though, I'm seeing a human being in front of me who needs my help, who needs the ICU team's help. I'm seeing families who need our help. And so my focus on that conversation at that time is to make sure they understand that we're doing everything possible with all the tools that could possibly help to try to get their loved one better. But it's certainly devastating when we're taking care of somebody who's immunocompromised, who is frail, who's elderly, who we know were surrounded by family members who weren't vaccinated, and now they're dying in the ICU. I've been most struck, though, by the younger folks, younger, healthier people that we were seeing in their 20s to 40s, the number of pregnant women who've either lost their baby or had to have preterm delivery in order to try to save both of their lives. This has been profoundly different, a profoundly different aspect of this spike compared to the last one. I know I'm blabbing on, but I think these stories are really important so that you know what we're experiencing here inside the hospital. The community looks pretty normal right now. People are all out. People are oftentimes not wearing masks. It's markedly different when you're in the ICU. So I'm really glad that we're able to share this today.
Well, and I think the stories are important, and it's why we did invite you on. We want you to share these. But tell me, I mean, you dedicate your whole life to helping people deal with serious illness and with death. We've had a very deadly 7 days. How do you do that? How do your staff? How do they keep dealing with it?
You know, I hear a range of emotions coming from our frontline providers, frustration being the most, and just being baffled that people are having a hard time hearing that the thing that will help most to prevent what we're going through right now is getting vaccinated. So, you know, I sense the hallmarks of compassion fatigue too. Everyone's trying to protect themselves emotionally and physically so that they can keep coming back to work to do this work. But there are staffing shortages. The beds are full. People are very sick. And when you're doing that for months upon months at a time, it's very hard on our staff. And so we're watching out for each other a lot, checking in with each other. How are you doing? Making sure we're spelling each other, doing our time on service, and then we try to get off service, get away, heal the best we can so that we can be prepared to come back.
How do you help people, and these families in particular, when they can't be at the bedside when their loved one is passing? How difficult is that?
You know, we do our best to try to keep families updated by Zoom. We've gotten pretty handy with the iPads. We can get family members in on the iPad so they can see their loved one at the bedside. There's a limited number of people who can physically come to the bedside, and if they have COVID or are sick in any other way, then they absolutely can't come. So, you know, the chronicity of death and the accumulation of this grief is really hard. It's hard on everyone. It's hard on these patients and families to go through. I don't know if I've answered your question, but
No, I think you have. I mean, from the get-go, we've talked about having to help people say goodbye on an iPad. And I
Yeah.
just think that I like to remind people that that part hasn't gone away.
Can I ask? So, Karin, I've known you for approximately a long time, right? A lot of years. So, how are you? Now, don't look at your script. Turn on your script for a minute. How are you, really? How are you, really?
you know, I had vacation last week, and today's my first day back, so getting back in the dunk tank.
Yeah.
I'm good, but I'm tired.
I would
People
think-
around me will know I'm a little crispier than usual.
Because I would just think so. I would look at this. The thing that's got to be so hard for your team is when you deal with a cancer death, or you deal with, lymphoma or end-stage lung disease. So much of disease is not preventable. This is preventable.
Yeah.
How does that change the calculus for you? Because it's just got to be different.
Yeah. You know, I was running a family meeting a few weeks ago now with a family of a man who was in his 40s and he was otherwise healthy. And he was dying on the machines in spite of everything that we were doing. And to share that message with the family was devastating for them to hear, but not surprising to us because we've watched this so many times now, you know. One of the family members asked me if vaccination could have prevented the situation that we were in. And knowing this man was young and otherwise fairly healthy, his chances of dying from COVID-19 if vaccinated were very,
Zero.
very, very
Virtually zero.
low, essentially zero. And so all I could do was nod. Would vaccination have prevented his death? Nod. Yeah. And I try to control my emotions, you know. I'm a pretty emotional person.
No, I've never seen that about you. I've known Karin for a long time. We've had a few discussions in our lives. Yes, I know you're emotional.
So I'm usually able to contain that, but I found myself just in tears with this family, just that we were sitting there in a situation that we could have avoided, and I was crying, they were crying, and so I told him, I said, we're doing everything we can for him, but we're out of tools that can help him. If I can tell you one thing that would be helpful now, it's to get vaccinated. And if that young man can represent, and we can all just see that, so that I'm not sitting there in an ICU waiting room with other family members doing the same thing, that would be such a blessing. That would be the miracle if we could change that dialogue and get vaccinated.
You know, you think about it, how many deaths have we had right now? 513?
503.
503. Okay, so probably 500 of those deaths should not have happened. What would those patients, what would those families do to get that back? All they would have to do is be vaccinated. It's just so foreign to me.
Mm-hmm. I also want to hear you talk a little bit and be candid, because we were, before we started the program, talking about, and I encouraged her to go ahead and share, is that another thing that's different with these deaths and with these families is I would imagine that with a cancer death or another illness, that the family is so grateful to see your team come in and help them get through whatever they're going through. And you said that some of the patients, though, a small percentage of them, or I don't know what percentage, but they're in denial in a lot of ways. Not that, just about the whole reason that their loved one is in there.
Mm-hmm. You know, we know when anyone's going through a serious illness and they realize that they or their loved one is not going to survive, that can be incredibly hard to handle. And sometimes when information's too hard to hear, it just doesn't go in. It's too scary. You don't trust the person who's talking to you. You need to hear that from someone else. And so we see it. We see people having a hard time coming to deal with the reality of that situation. The nature of COVID-19, it's an acute illness. It's not something somebody's lived with for years to try to prepare. And all of the other things and information coming in from society that change how we just do our job as medical providers about here's what's going on, here's what we expect to happen, here's what we're hoping for, but here's what you need to prepare for if it's not working. Folks are having a really hard time with that. In the first waves of the pandemic, it seemed like the ears were more open. There is a trend of conversations where we're trying to explain what's going on, and it's not being heard. And so,
well, it's not the patients, because there's such a narrative, right? If you think about it, this week in Virology was pointing out that 80% of Americans and 90% of Americans now believe in vaccination, and the number of anti-vaxxers is slowly and steadily decreasing. Well, that's really good news. But then you have the spark money from the Kansas legislature, and they're saying if hospitals, to help support nursing, if hospitals have a vaccine mandate, you can't have the spark money. Well, I'm sorry. I'm not going to be political, but I'm just going to say, from a medical perspective, you're saying that if we tell our staff they have to be vaccinated so they can stay safe and take care of patients, we can't get the money because you're afraid we're going to chase off our staff. Do you realize so let me stay in my lane, but by God, you stay in your lane. And don't come swerving into my lane and tell us how to run the hospitals, because what you're really suggesting is we're only going to support you if you continue to let your hospital staff be at risk. And that puts patients at risk. That just doesn't add up. And that creates that anti-vax, and that whole mentality that vaccination's bad, masking is bad, and y'all are bad because, COVID, these people don't really die of COVID. And it's infuriating when you're practicing in the profession and people try and tell you how to do that job.
It's really just impossible to describe what it's like at the bedside until you're there. To know how intense that care is, and that we're doing everything we possibly can. But these folks are on machines. They're on lots of machines. They're sometimes on so much oxygen, there's no more oxygen to try to get into them. and that we're doing our very best. But it really is surreal unless you're there. I'm so happy, not happy, but I'm really glad that we're doing videos that show the reality of this situation, how devastating it is.
Well, speaking of which, let that still play. And this is a situation where a patient is being proned, and so doctors explain what that means.
Yeah, because what happens in lung disease is a lot of times the injury to your lung is more in the, you can think of it, the back half, the front half, and the back half of your lung. And when you're on a ventilator and you're laying flat on your back, blood flow really goes to the back half of your lung where all the injury is. So we turn people over, which is what you're watching the staff do that, to put them on their stomach so that the blood flow goes to the front half of the lung where there's less injury. And that's called prone ventilation. You can do that for a certain number of hours a day. And what you're really trying to do is move the patients around so you ventilate different portions of the lung, hopefully with the idea that there's less ventilation. It requires, as you can see, a team of 5 people in this video to do that.
Sometimes 7, I'm told.
Yeah, well, for folks who are bigger, the bigger the person, the more the staff. And what you really have to do is make sure you don't pull lines out or pull the tubes out around their airway, because if you do that, that's really devastating. Prone ventilation has been around for years and years and years. It's just turned out to be particularly effective here. And what Karin described is right, and there you go. You're watching them roll the patient. The problem is that you give so much oxygen. You can get up to 100% oxygen. Normal oxygen in the atmosphere is 21%. You get up to 100% oxygen. The problem is that that amount of oxygen causes a lot of lung injury, and that can actually make, pretty soon now you have not just the COVID-19 problem, but you also have injury from the ventilator itself to lungs, and that's when we get into a difficult spiral, and that's when people die.
And keep this going just a little bit longer, Cliff, if you can. So this patient, I happen to know, and I wanted somebody to help me understand.
Yeah.
They proned the patient because the level was down to 90%.
Yeah.
And seemed to be dropping.
Yeah.
Proning got it up closer in the upper 90s almost immediately. What happens? I mean, why is that such a concern?
Because, okay, so think about this. If here's my body and I'm laying flat, where does the blood flow? Here, so my heart's in the middle of my chest. Does the blood push up or does it go down? Some blood goes up. If you think about it, you're laying flat, your heart's right smack in the middle. Part of your blood does go up, but most of it goes down, all right? So you're putting blood down to pick up oxygen when it travels by the little air sacs in your lungs. Well, if those air sacs are injured, it doesn't pick up much oxygen. And so what happens when you've been on your back for a while, that's where most of the injury is in your lung. And most of the injury, both from all the different mediators, all the different inflammation in your lung, tends to be in the back part. And then, so what happens is the front half of your lung spared. So you roll people over to get to the part that's spared, so the blood will then go to the good part of the lung and not to the bad part of the lung. And that's why oxygen levels go up for a while. It's a temporizing measure. It's not anywhere near as good a therapy as vaccination prevention, but it's a temporizing measure to help decrease the amount of oxygen, because if you get somebody down to 50 or 60% oxygen, not 100%, they'll have less injury to the lung. 100% oxygen is very toxic to your body tissues.
You know, the thing I'd add about what you're seeing in this video, Dr. Stites and Hawkeye and myself are doctors, and so we write orders and then we leave the room. There are 5 ICU nurses who are at that bedside, and those ICU nurses are there at that bedside all day long, every day. And I'm going to cry. I have such profound respect for these bedside providers who are doing this. They are so tired, and they are giving their souls to help everybody get through this. And when I see that picture and I worry, you know, could we have avoided this? We can. We don't need to be doing this. Please just get vaccinated.
And you know what? It's not only true on the inpatient side, it's true on the outpatient side. The outpatient, case management, nursing staff, respiratory therapy, all of them. People are exhausted at every level. I think you're right about the ICU nursing team and respiratory therapy. Those are remarkable individuals they've hung in there. The floor teams are remarkable individuals throughout the hospital. And the outpatient side has just gotten so sick and so difficult. And then you get the questions raining in from all your patients about masking, about vaccinating and blah, 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 and you just answer it constantly. And you're right. We physicians get to drop in and write the orders and move on to the next great thing. The nursing staff, respiratory therapy staff, they're with this problem all the time. And if you really want to look at COVID fatigue, go search the eyes of our nursing and respiratory therapy and other staff. Search their eyes and see what you find. Early on, there was determination, and then there's hope, and now there's exhaustion. And I think that makes me fear for the fall, Karin.
Mm-hmm. Mm-hmm. Well, these people are, everyone that we work with on our team is here for the right reasons. I see a lot of tired too. And I think part of it also, in the beginning, there wasn't a way to prevent it. It was a bad thing that was happening, and everyone was on the same page about fighting that thing that we couldn't control. And now there are tools to use to control it the best we can. And so, us using all of those tools that we possibly can before we end up on ICU machines, before we end up in a place where the tools aren't as helpful, let's use the ones that do.
Right. We got about not quite 10 minutes with Dr. Stites, so let's do some real quick questions and then we'll do a wrap up. Stacy wants to know, I keep hearing about healthy vaccinated people dying of COVID. How worried should I be?
Healthy vaccinated people are not dying of COVID. I don't know where you listen to, Hawkeye. I mean, that's not a thing. I mean, the people who are dying of COVID have been vaccinated are people who have, have organ transplant, end-stage cancer on chemotherapy, et cetera. Healthy people vaccinated are not dying of COVID, Hawk.
Yeah, I would totally agree. The vast majority of the people that are hospitalized are unvaccinated. The vast majority of the people that are dying are unvaccinated. And those that are fully vaccinated and dying, again, a lot of them do have the comorbidities, the lung disease, heart disease, immunosuppression. We know that is true for our select patient population, but around the nation, the majority of those that are vaccinated, the vast majority that are dying and are vaccinated have significant comorbidities. They aren't the otherwise healthy patients.
Nationally, the data is over 98% of deaths are in unvaccinated patients, and only a very small percentage are unvaccinated. And of those who are vaccinated, they're all have. You just would predict that they'd never responded to the vaccine to begin with.
So now Stacy knows, and she can correct others when she keeps hearing that. That is a falsehood. That would be a myth. Jennifer wants to know thoughts on progress toward approval of a vaccine for children under 12. And I know, Dr. Hawkinson, you had some thoughts about kiddos.
Yeah, again, I think the FDA has just wanted more information about those younger patients that are going to be vaccinated, so they asked that the trials include a larger population, and that's what we're waiting on. I do believe it is going to be safe, but the FDA, CDC want to be able to have more patients in so they can see those data signals if there is some sort of adverse event. But we've also know, and there are two very good morbidity and mortality weekly reports out now by the CDC that do show that, so first of all, the unvaccinated people that are 12 and over that do have the opportunity to be vaccinated but aren't, are at 10 times higher likely chance of being admitted to the hospital. There is also another publication, MMWR, looking at spread in those pediatrics younger than 12, and the communities that are better off are those communities that have a higher percentage of vaccinated people for protecting those kids even around that community. So certainly we all want those kids to be vaccinated. Hopefully it'll be sooner rather than later. I think most people are expecting in early October to have some sort of guidance from that after all of the most recent data from those young pediatric population trials are in.
Nancy got the J&J vaccine recently, and she says about 6 or 7 times a day I get to the point where I have to sit down. I just feel yucky and nauseated, and oddly enough, my arm still hurts. Do we want to speak to side effects on vaccines?
Yeah, I don't know. So she said she got the J&J vaccine. I would want to know when, first of all. Was it a few months ago? Was it a couple weeks ago? It's hard to tell. It's unclear if those symptoms are really related to the J&J vaccine, those systemic symptoms.
It was on Friday.
It was on Friday. So if your
Yeah.
arm is still painful, I don't think that's anything too out of the realm of possibility there. It should be going down day by day. And as far as those other symptoms, probably what we would call fatigue or malaise, those should resolve as well. We know that some of those symptoms can last several days, 3, 4, 5 days, but they really should be getting better now the further out you get from the vaccination.
Yeah, really,
time.
since Friday to Tuesday is really not a very long period
Correct.
post-vaccination.
Absolutely.
And some people do have a longer period of that. It's unusual, but they do. But to your point, that's gone after a few more days.
Can I just say too, not to discourage anybody, but my Shingrix shot for
Yeah, it's
shingles.
a lot more painful.
Oh my goodness! That made me sick. Made me.
Most people would say that.
Yeah.
Most of my patients saying I was not about Shingrix, and my second Moderna shot, I was pretty sick for about 12 hours
Yeah,
with
you were.
fevers
I
and chills and
remember that,
stuff.
yeah.
Now I was fine after that. But
Yeah. Well, and me too.
I think that's just part of the deal, folks. But let me tell you,
Yeah.
whatever the side effect you have from the shot, I promise you this. It is far less severe and far less, because it's going to make you a lot less sick than COVID-19 is. And so it's not even comparable. And the rate of infection with Delta variant should concern you. So if you haven't been vaccinated, the way out of this pandemic, America, the way out of this pandemic, Kansas City, the way out of this pandemic for every individual is vaccination. It still is the answer. It still is what's going to make us be able to get back to normal. We need to get 85% of America vaccinated and end this dadgum thing, and we can do it.
So, do you have time for one more question, or do you want to
go.
book?
Go.
All right. Linda wants to know, the CDC, what is the CDC recommending for boosters for those vaccinated in January and in February?
Now, right now, they're not recommended because at the moment, the FDA and the CDC and the Biden administration are not agreeing. And so, and whether it's going to be Pfizer, Moderna, or something else. There's some interesting data coming out that the Moderna shot has longer lasting immunity than the Pfizer one. I'm curious to see what Hawk thinks about that.
Yeah.
The guys on Twitter were talking about that from last Friday a little. It's kind of preliminary. But so I think with the CDC, I suspect what CDC and FDA is going to say that if you've had the Pfizer vaccine, you may want to think about a booster after about 8 months in certain disease categories. Not sure about others. Now, the simple reality is you can go get a booster if you want right now, because it's not hard to go get a booster because not everybody's really checking. So I know a lot of patients are just going to go out and get one. I don't know that there's any harm, but I don't think there's I know there's not an official recommendation yet from the CDC and the FDA, Hawk.
Is there any harm?
Yeah, I would totally agree with Dr. Stites, first of all, that there is no official recommendation. And once there is, after that time period, 8 months or a year, what is that going to be? It will either be the whole general population, or it will be subsets, such as those that are over 60 or however that may be. And we have to ask ourselves, why are we doing this? Because we know that the vaccines still provide great protection, even 8 or 9 months out, from severe disease, hospitalization, death. That's even with the Delta variant. That's with all the variants. So I think we are still waiting for guidance on exactly when and why. And is it safe? Yeah, I think so far what we have seen in those immune suppressed populations where it is recommended to get additional dosing, that it's safe. And overall, we have heard other stories of people getting additional dosing, whether by mistake or on purpose. It does look to be safe. Again, we don't have the full data set or anything, but certainly believe at this point in time that it is safe.
Joe, can I have my final thought right now?
Yes, you may.
I want to say a special thank you to everybody out there who has been vaccinated and wearing the mask and listening to the science and believing in that. We say this almost on every single program. The rules of infection control continue to keep you safe. They travel with you wherever you go. And we prove it every single day, every single moment of every single day on our large number of COVID patients where people are safe, taking care of them by wearing a mask. You can stay safe too, and then get vaccinated, because that keeps you safe and keeps us all safe. And I want to say a special thank you to Karin Porter-Williamson, who taught me more, and Sarah Taylor, who taught me about palliative care, the way it should be done as opposed to the old way I wanted to do it. I want to say a special thank you to you and your team, because during the most challenging of times with our staff and with the physicians at the bedside, I just want to say a special shout out to you and your team for helping people die without the people around them who love them the most. That is a remarkable thing. Thank you.
Thank you, sir.
We'll see you tomorrow.
Yes, ma'am.
You're coming back?
I'll be back.
All right,
Hey,
you'll
good
be
luck.
back. Yep, all right. So let's take a couple of more questions. Sandy wants to know, are there any variants like MU that you all are concerned about at this time?
No, I think the World Health Organization, the CDC, are always going to be tracking new variants that arise, but we have seen new variants since the early part of the pandemic, and at first it just started with the D614G variant, which was quite a bit different than that ancestral strain and maybe lended itself to be more transmissible. So that was about April of last year. But we have seen since that time more variants come up. Right now, the major variant is Delta, and that is the major surge not only in our country but around the world. So we will keep monitoring those things. But right now, there's really no imminent threat or danger from any other variants at this time. So far, what we've seen is Delta has really come into certain communities or our country and a lot of other countries and just outcompeted the other variants. So right now we're just keeping an eye on it. But the good thing is, again, vaccination, the current vaccinations that we have seem to provide very good protection against all the variants.
Okay, and Ashley wants to know, do you recommend Moderna or Pfizer? If you got to choose, which would you recommend?
I think either one of the mRNA vaccines are both very good, so I would just get either one. I don't think either one of them is better than any other at this point in time. Just get whichever one you can.
Brianna, and I hope I'm saying your name correctly, she wants to know, she works at a swab clinic, and she wants to know, are we getting boosters anytime soon? Should she?
Yeah, again, I think if you are otherwise healthy, non-immunocompromised, so you don't have cancer, you don't have untreated HIV or AIDS, you're not on chemotherapy or other immunosuppressive drugs, if you got vaccinated even in January of last year, right now you are still very well protected against that whole spectrum of COVID-19 disease, but especially the more severe forms. So right now, really there's no indication that you would need to go get vaccination. We have seen some data signals, and we know that the CDC is looking at the published data as well as unpublished data. I believe there will be some guidance or messaging coming out later in September, around September 20th. So at that point in time, we will go ahead and see what they say. In addition, we also have to look at why are we using additional dosing or boosters. Is it to stop, maybe increase our ability to stop transmission, or is it to stop severe disease, hospitalization, death? Again, right now everybody who is fully vaccinated is still very well protected against that. So I think we're still just kind of waiting for the full messaging to coming out again later this month.
Christina has kind of a long message, but I think at the heart of it is that she was trying to call and get more information about her Moderna shot that she got, and couldn't get through to anybody that she could understand or want to talk with. She's only had one vaccination and she's scared. She's afraid to get the other one. What would you say, Dr. Hawkinson?
Yeah, well, I think we have to just understand why is she afraid to get it. Still, we know, and more data, all of the consistent data really fully does support the fact that those that are best protected, even at 8-9 months from down the road, are those that received full vaccination, so did receive those 2 doses of the mRNA vaccine. So really have to understand why you are concerned, why you are scared. That's the major issue there, so really can't answer anything other specifics than that. But overall, for full protection, everything that we've talked about, protecting against hospitalization, severe disease, and death, you really need that second dose. And even if it's been a couple months since you got your first dose, really the recommendation is to go get that second dose.
Okay, we'll take a couple of more and then we're going to call it a morning. Jamie wants to know, how do we convince people to get vaccinated, let alone wear masks? Jackson County is horrible.
Yeah. Well, I'd like to kind of throw this to our guest, who is so good at talking to people and really understanding.
Yeah, this has plagued us through this whole pandemic. How do you get through to people who are difficult to get through to?
I don't know that there's an easy answer to this question, or as a society we would have figured it out by now, I hope. But I think it really, I think it comes down to everybody listening to each other. And being kind and trying our best to understand each other. I think most everybody in our country wakes up in the morning to want to do good and be good and help. So understanding what are the things that'll help and how, and what's the truth, what does science tell us, that we just have to lean on the best information that we have right now, and then when we learn better information, we use that information. So I think if we stick to the hallmarks of what is true and what has data behind it, and that we really listen to each other when someone is scared, what's driving that, and how do we help support them the best we can. I think the other thing is, as time goes on, more and more people have personal experience with COVID-19. I'm knowing more people who are having loved ones who are critically ill or dying of this. And I hope it doesn't take all of us losing people we love in order to do the thing that's most helpful, which is vaccination. That's my final. If you were to say, what's my final thought? That's be kind, get vaccinated.
Right. Do you want to add anything?
I mean, I would certainly agree. I think there's just such a wide breadth of reasons why people don't want to get vaccinated. And sometimes it is just answering the questions and dealing with the science and numbers. But other people, there are other reasons. And I think it takes them listening to people that they trust, whether it's their family or their friends or other people in their inner circle, that no matter what a physician or a public health person says, they still aren't going to do it until they hear it from another source, or until, unfortunately, they experience tragedy themselves.
And I'm going to add, I'm not a doctor, but I am the daughter of a minister who is not with us anymore. He died back in 2016. But my daddy always used to say, you also have to be intentional every single day. You got to get up. And so my intentional thing that I did recently was take Facebook off my phone. And I know Facebook is how we communicate with you guys. I didn't get rid of it. I just took it off my phone and told my family, if there's a photo I just got to see and you got to share it with me, or a movie, send it to me in text. Because some of the messaging there is distracting from what we know to be true. All right, last question goes to Debbie. Is there really a 90-day immunity against COVID for unvaccinated child who's too young to get vaccinated, who has already had COVID? So I think Debbie wants to know, is her child protected for 90 days?
I think this is there's several answers to this question and several layers. Certainly the CDC guidance would be that if you had COVID-19 in the past or within the last 90 days, there is a consideration that you are protected, and this does go into considerations of quarantine after exposure and things of that nature. I don't think we fully know exactly how much you are protected, and this would go for anybody who has mild disease. How good is that immunity? But right now, the guidance from the CDC, and they don't make other distinctions, is that if you've had COVID-19 within 90 days, then you certainly would fall into that other category of monitoring for symptoms after exposure. So they do believe that there is some sort of significant immunity there against reinfection within that time period.
All right. So I know, Dr. Porter-Williamson, you gave some final thoughts, but I'm going to give you one last chance to say a final word.
I have a friend who is an emergency department nurse in Florida, and her partner is a respiratory therapist there. And she posted on Facebook, this is how I would stay in contact with her, that message of just understand if you know, love, or interact with healthcare providers or are seeking medical attention, just be aware of what those people have been going through for months now, trying our best to take care of you. And so everybody having extra grace with one another, kindness, and knowing we're all doing the best that we can in very difficult circumstances. And get vaccinated.
Yeah, Melinda, and that kind of, Melinda was asking, what can we do for people like you and Dr. Hawkinson? What is it that you need? And I think some of what you just said is good advice.
Yeah.
Because people do want to help. Dr. Hawkinson, your final thoughts?
I think it's just the continual running theme. Be kind to other people, have some compassion for who they are, the way they see the world. We try to answer those questions with compassion, but most of all, again, more and more data comes out, even community-wide data with infection rates and vaccination rates in those communities that are better protected, even for those children 12 and under who are unable to get vaccinated right now. It is always better off with higher vaccination rates. So please encourage those that you know who are not vaccinated to please go get vaccinated.
All right. Well, thanks to both of you for being with us. And Dr. Seitz, tomorrow he will be back with open mics, and Dr. Gregory Paulin, director of Mayo Clinic's Vaccine Research Group, is back to talk about vaccines and virus variants. So bring your questions. That's tomorrow morning at 8 o'clock. But before we go, we know our chaplain staff and palliative care teams share similar experiences. They work very closely together when providing end-of-life care to patients. Here are some parting thoughts from Chaplain Kathy Riegelman. We'll see you tomorrow.
Good morning, Stephanie. Is this a good time to come in and pray?
I think it feels different because we've been to this place before, and that brief time of hope just seems like it's been swallowed up by what we're dealing with now. And it happens so fast and so furiously.
God, please gather them in your arms.
Part of the way I provide care for people when I'm at the bedside and someone's dying is having to pay a lot of attention to listening, and it's not just listening to the words, but being very aware of people's nonverbal communication too. The hardest part about being at the bedside when someone is so sick is that I know my job is not to fix things. The hardest part is that ability to be present in the midst of such heaviness and such grief and such sadness, knowing that there's no magic wand to wave to make this better.
Maybe this would be a good time for me to go in and have a prayer at the bedside.
I think what makes it even harder with COVID is that we do have some tools to fight back against this. And if people will make use of the vaccines and masking, we might not be there at the bedside. It hurts so badly when I hear people say that they feel like God is going to protect them. I really want people to know that there are ways that God may have provided for us through science, through vaccines. Science and faith can come together beautifully to help people.
I don't know how you've been doing it day after day, and gosh, what's it been, 16, 18 months now.
Faith means not just taking care of ourselves, but loving our neighbors. And if we can take care of our neighbors and not spread COVID, then to me that's an act of holiness.
Subscribe to our morning medical update and open mics with Dr. Stites podcasts. Now everywhere podcasts are available.